good afternoon. I'm Dr. Venkatesh Pothula. I'm the consultant interventional radiologist in KIMS Hospital, Visakhapatnam. Today, I'll be describing about the uterine artery embolization, or few people call it as uterine fibroid embolization. So, what is uterine artery embolization? Uterine artery embolization is a modality where we enter the uterine artery and cut off the blood supply from inside. So, just embolization is a fancy word. It can be used anywhere in the body. It's basically blocking an artery from within using different materials. So, what is uterine artery embolization and where it can be used? Uterine artery embolization commonly done in cases of uterine fibroids or in cases of postpartum hemorrhage, nothing but bleeding after a pregnancy, or we do in a cases of adenomyosis. So how the patient how the patient is selected and what is the selection criteria? Commonly, patient with fibroids, they will have symptoms of heavy menstrual bleeding, like increased bleeding during menstruation time, or increased days of menses, like more than 5 or 6 days. Or few patients have symptoms related to the pressure, like increased frequency of urine, constipation, or feeling heaviness in the pelvis, or few patients present with infertility. So there are spectrum of presentations related to fibroids. In the cases of adenomyosis, patients will have diffuse tenderness or pain in the lower abdomen, or there is pain during intercourse. So it depends on the pathology and or the location of the disease. For example, fibroids, they can be located on the surface of the uterus, or within the muscle layer of the uterus, or just below the mucosal layer of the uterus. So the presentation vary depend on the location as well as the size of the fibroid. And if you take uh, these symptoms as a consideration, anyone can have uterine fibroid who is having the symptoms listed prior. So if you have any of these symptoms, please go to the ultrasound center or any hospital and get an ultrasound done, so that you may have a uterine fibroid if you have those above symptoms. After ultrasound, if you have a uterine fibroid, later MRI is helpful to decide on the further management. And coming to the procedure of uterine artery embolization and how it is done and how it is different from the other modalities of uterine fibroid treatment, like surgery or myomectomy. Surgery and myomectomy were the gold standard prior, like 5-10 years, still last 5-10 years. But uterine artery embolization evolved as a safe and effective way of treating uterine fibroids or adenomyosis. So the main difference is the safety profile of uterine artery or uterine fibroid embolization, uh, because it is a lot safer and patient won't require any general or spinal anesthesia, and the patient can be discharged either on the same day or the next day following the procedure. And there will be minimal or no blood loss for this procedure. Just I'll describe you few steps of uterine fibroid embolization or uterine artery embolization. Any female patient will have two uterine arteries, one on the right side, one on the left side. We either enter from the thigh artery or hand artery, and then from there we use a very thin catheters, 1 to 2 sized catheters, and we enter the uterine artery and we inject a tiny graded particles which are called PVA or polyvinyl alcohol particles. After embolization, we just remove the catheter and sheath, and we observe the patient for a few hours, and the patient can be discharged either on the same day or on the next day. So this is how it is done, and the advantage is we won't completely block the supply to the uterus because we super selectively enter into the arteries which supply the fibroid. So we preserve the supply of the uterus. So in by this, what happens is patient will be retaining uterus so that there will be chance, or the patient will be given chance to preserve uterus, and the fertility will be preserved later. It is not the case with hysterectomy because uterus will be removed in hysterectomies, or not all patients are eligible or the candidates for myomectomy. So these all candidates can be addressed with uterine artery embolization. And another important thing regarding uterine artery embolization is the main one of the main thing is blood loss, because it doesn't involve any cuts or sutures. There is very less likely chance of bleeding during the procedure. So the main advantages, if you observe, is the it is almost like a daycare procedure. There won't be any cuts or scars, and patient can be safely taken up for this procedure even if they have severe comorbidities like uncontrolled diabetes, hypertension, or high risk to general anesthesia or spinal anesthesia. So these are all candidates who will have severe other comorbidities can be addressed with uterine artery embolization if they have fibroids, adenomyosis. So as a interventional radiologist, I would like to uh, elaborate regarding the uterine artery embolization advantages and the indications of uterine artery embolization. If you ask me regarding the contraindications, like just because I described the uterine artery embolization indications and how it is done, almost all patients can safely undergo uterine artery embolization except patients who will have a high risk of contrast allergy, or patients obviously who are pregnant. So almost all candidates can undergo uterine artery embolization. And other main thing is that in the society, especially in Indian scenario, how females think that they will be having uterine fibroids, but uh, they are not evaluated and they will be unnoticed because they think that losing blood of extra blood or of the extra duration, they consider it as a normal thing, and they'll become anemic over a period of time. So they'll impart these symptoms to some other thing, and they'll be neglected. So if you have any of the symptoms like heavy menstrual bleeding, or increased duration of menstruation, or pelvic pain, or if you're suffering from primary infertility, just just consult a doctor and get an ultrasound done so that you'll be tested whether you will have uterine fibroids or not. So, what are the we discussed what is uterine artery embolization, what are the indications, what are the contraindications, and we compared uterine artery embolization with a surgery or myomectomy. And coming to the other uses of uterine artery embolization, that is uterine adenomyosis or as a modality to control postpartum bleeding. And the advantages, I'm just repeating again, that it is done as a daycare procedure because patient doesn't need any general anesthesia or spinal anesthesia. It is done under local anesthesia, and the cost of the procedure is like any other surgery or myomectomy. It is not more than that. And its safety profile, because it a patient doesn't lose any blood that is expected during the surgery or myomectomy. Uh, Hardly the blood loss during the procedure is hardly not even 10 ml or 15 ml. And the patients with rare blood groups, they can consider this option of uterine artery embolization if they are suffering from uterine fibroids. And other things like duration of hospital stay. Patient needs only 1 day or 2 days of hospital stay for uterine artery embolization. And if you ask regarding the fertility, because in uterine artery embolization, we are not removing the uterus, we are just addressing the blood supply of the uterine fibroid or region of adenomyosis. So we are not removing the uterus, so the fertility is preserved. Compared to other normal individuals, the fertility will be slightly reduced, but not to zero like patients who undergo hysterectomy. So there are a lot of studies and case reports who conceived after uterine artery embolization. Even in our experience, we have done more than 150, 140 uterine artery embolizations, and around 6 to 7 patients they conceived after uterine artery embolization. So this is our experience, and the thing, another important thing of uterine artery embolization is uh, is its effectiveness in reducing the menorrhagia or polymenorrhea and the pelvic pain. So it is best in the patients with the fibroids who presents with the increased menstrual bleeding or a pelvic pain. So if you have any symptoms related to uterine fibroids like heavy menstrual bleeding, pelvic pain, or infertility, or pressure related symptoms like pelvic heaviness or constipation or increased frequency of urine, please consult the doctor and get checked. And this is regarding uterine artery embolization. And thank you for your patient listening. One person is asking if uterus is not removed in this procedure, can women have a baby? Yes, definitely they can have a child after uterine artery embolization. And another person is asking, what are the symptoms? Uh, what are the symptoms? So the symptoms of uterine fibroids, like I already told, they can be heavy menstrual bleeding. They can be pressure-related symptoms like pelvic pain or increased frequency of urine, constipation. And after embolization, patient with large uterine fibroids, they can have a pelvic pain and heaviness. These can be managed with pain medication for a duration of around 4 to 5 days. It is very uncommon to have these symptoms after 4 to 5 days. And the other person is asking how can we determine cancerous and non-cancerous fibroids. Just we do MRI pelvis before going ahead with the uterine artery embolization. In MRI, based on the characteristics of the fibroid, we can certainly divide these benignly. We can divide fibroids from the or leiomyomas from the leiomyosarcomas. So sarcomatous degeneration you can guess based on the MRI findings. And patients who have decent contrast take up during the MRI examination, they are the best candidates because they have a decent amount of vascularity derived from uterine artery, so they'll respond best when you do uterine artery embolization. And what is the indication for uterine artery embolization? Just as I elaborated, the indications the patients who have large or uterine symptomatic, especially symptomatic uterine fibroids or adenomyosis, uh, and also the candidates who are not eligible for surgery or myomectomy, they all can undergo uterine artery embolization in a safe manner. And one person is asking how long the uterine artery embolization procedure takes. Uh, Generally, the uterine artery embolization takes from around 40 minutes to 1 hour based on the arterial anatomy of the patient, and the procedure cost varies depend on the size, number of the fibroids, and it costs average from 1 to 2.2 lakhs. And one person is asking what are the long-term side effects associated with uterine artery embolization. The long-term side effects of uterine artery embolization is around 5% of the patients will complain of either no periods or missed periods. This is common, but they'll regain their menses back shortly. But it is reported in 5 to 10% of the patients, which is called ovarian insufficiency, and it is not so common if you do a super selective embolization, that is where we use a microcatheter to enter specifically to the arteries which supply the fibroids. So we don't see those cases much nowadays because with the advent of high profile microcatheters where we super selectively go to the uterine fibroid supply rather than embolizing uterine arteries. Another person is asking, could you explain the key distinctions between fibroid embolization and uterine artery embolization? Uh, this uterine artery embolization or uterine fibroid embolization, people they use these words interchangeably, but what uterine artery embolization is just cut off the blood supply of the uterine artery. Just we enter the uterine artery, which is the anterior division of internal iliac artery, selectively and embolizing. So this method we follow in cases of postpartum hemorrhage because placenta is very large organ and it derives blood supply grossly from both uterine arteries. So you can't super selectively embolize in that case. So that is what uterine artery embolization. But in cases of uterine fibroid embolization or adenomyosis embolization, we super selectively go into the arteries which supply fibroid or area of adenomyosis. what is the cost of the procedure? Yes, I already told the cost of the procedure is depend on the size and the number of the uterine fibroids. So it costs from 1 to 2.2 lakhs, and the treatment is covered by majority of the insurance companies. And if you see the age group of the patients who develop or who are more symptomatic with the uterine fibroids are around 18 to 50 years. Any women with this age group can have uterine fibroids. So, with the high index of suspicion, if you have any of the symptoms, please get tested and evaluate further to decide on further management. And another person is asking, do fibroids have potential to reappear following embolization treatment? In this, you should understand that we are not removing fibroid in this uterine artery embolization. What we are doing is cutting off the blood supply of uterine fibroid so that it will shrink over time. So it may not disappear after uterine artery embolization, but it will become asymptomatic or shrink in size to a very small size that it won't be symptomatic further. But regrowth of uterine fibroids after embolization is very uncommon phenomenon, and even if it is regrown uh, in a very rare case, we can repeat the embolization if such thing happens. Could you outline the disadvantages commonly linked to embolization procedure? Yes, patient uh, can have like not a disadvantages. It's like a patient can develop post embolization syndrome in a case of very large uterine fibroids, and they can have uh, ovarian failure or premature ovarian failure. In a case of, as I told, like 5 to 10% of patients will develop ovarian failure. Other than that, there are other disadvantages or risk factors of uterine artery embolization is like any other angiographic procedure. Patient can develop groin or hematoma or hemorrhage after uterine artery during the process of uterine artery embolization, and from entry point to the delivery of PA particles, all the vessels are prone for injury, but they can be minimized with the proper technique and expertise. And another person is asking, do fibroids grow back after embolization? No, it is not so common to grow back after embolization, but it happens at times. And if you are embolizing bilaterally, like if you are taking care of branches from both uterine arteries, it is very unlikely to grow back. Exactly the pathology of uterine fibroids, uh, why they arise, it is like almost a random occurrence, and they depend on the uterine vascularity, as well as they have a hormonal dependent growth that's why most of the uterine fibroids, the patients with uterine fibroid, they present from around 15 to 18 years to around 50 years. So the reproductive period. So most of the uterine fibroids, they depend on the uh, hormonal status of the patient as well. And another person is asking which is better, hysterectomy or embolization. Yes, I would say if the patient is in reproductive age and they're planning another child, or they wanted to retain uterus, uterine artery embolization is the best procedure to go ahead with. I won't uh, suggest you to undergo hysterectomy. And the patient is asking, can exercise shrink fibroids? There is no such data that exercise can cause shrinking of fibroids. Thank you, Ritesh sir. Thank you all for your kind attention for this YouTube and Facebook live session on uterine artery embolization.